Together we faced this disease and we fought back as a community, and it worked. Our infection rates dropped dramatically. And how did we do that? We stayed socially distant, we washed our hands, we wore our masks, and later on we got vaccinated, and it worked. Our community rates have fallen dramatically over time. And as everyone knows today, we are seeing another surge in COVID with the Omicron variant. This week, the United States had a couple days where we had over 1 million new cases. Pennsylvania continues to see the effects of this pandemic. In 5 of the last 7 days in Pennsylvania, we saw over 20,000 new cases of COVID. Hospitalizations continue to increase. A few weeks ago, there were 5,000 patients in hospitals suffering from COVID. Today, there's over 6,400 in just a very few days. And Luzerne County continues to see a dramatic increase in cases. A few days ago, we had over 700 new positive cases. So the pandemic has come back, and it's come back very strong, and it's had an impact on our hospitals so far. Our hospitalizations, we continue to see an increase in patients. Our emergency department has been very busy. A few days ago, we saw over 138 patients. And we're seeing staffing problems outside the organization at our nursing home. We have a difficult time transferring patients outside the hospital to nursing homes because the nursing homes don't have the staff. Staffing is hard in hospitals. We're seeing a national shortage in healthcare workers through every state in the United States. Some people say is that the COVID vaccination that is causing this shortage of healthcare workers, and the answer is no. We've lost very few employees to the COVID vaccine mandate. The staffing shortage is a result of people retiring, people being burnt out and leaving the healthcare workforce or moving to other positions. So all this combined together is just making it's creating a lot of stress on hospitals, and it's not just in Luzerne County. It's in every county in Pennsylvania and every state in the United States. So it's causing some long wait times in our emergency departments. It's causing wait times to be seen in the ER. It's causing slow times to be transferred up to the med-surg units. It's also causing problems being discharged from the hospital. So there's a lot going on with COVID, but together we're working together to make sure that we're here to care for the residents of Luzerne County. I want to salute our workers that are here every day. It's been very stressful on them coming to work the last 2 years and dealing with this pandemic, but they show up every day because they care about their community. Just a few charts I'd like to share with you. So here are the cases in the 6-county area that Lehigh Valley serves. So as you can see, the first wave, April, that began in May of 2020. Then things quieted down for a while. We had a second wave, third wave, a fourth wave, and now the fifth wave and the Omicron plus the holidays. So you're seeing a dramatic increase in the number of cases in our region. This is the census at Lehigh Valley on how many patients. So as you can see, last January, we thought was the peak of the COVID crisis. There were about 500 patients that we were taking care of in all of our hospitals that were COVID positive. As you can see, things got better, continued to get better. And if you look today, we're close to, the graph ends here at, that's 12:30. There's another 20 patients. So the inpatients continue to increase in our network. We anticipate this increase is going to happen probably till the end of January, early February. This is testing. Jody's going to talk a lot about testing. When you look, this is our testing in Hazleton itself. We had an initial spike because we were early hit in the pandemic. As you can see, this is the testing last year during the big surge. And as you can see now, the testing continues to significantly increase. And this is inpatients locally. As you can see, we continue. This is beginning in August, and right now we're at 33 patients in the hospital. So it's a statewide issue, it's a network issue, and we're seeing it locally. All right, we'll start with Tony Valente. We'll turn it over to him.
Can everybody hear me? I'm on my phone. Yes. I was having some difficulties. Okay. Yeah, as Terry said, I just want to I'll give you an update on where we are at the hospital. We have 33 people in our hospital with COVID right now. 2 of them are on ventilators. That actually represents about 50% of the people that are in the hospital have COVID. And once again, as Terry mentioned, we expect this number to go up further. It almost certainly will, and it almost certainly will surpass where we were last January, which was our peak. We don't see any reason why we won't surpass that. With a little luck, maybe we won't, but certainly the numbers do look like they're headed in that direction. I'd just like to spend a little time on the issue with this. Unfortunately, if you go back to the beginning of the pandemic and even last year, we were in the position we were in because we did not have a vaccine available. At this point in time, things are different, and I think you can safely say that the reason we are where we are is because of the vaccination status of people that are coming to the hospital, which the majority are unvaccinated. At our facility, we have about a 79% unvaccinated rate of hospitalizations, and that is consistent almost wherever you go. I'll just give you some quick numbers and you'll see the consistency. Reading Hospital has an 81% unvaccinated rate. Yale in New Haven has an 80% unvaccinated rate. But our network as a whole, the Valley Health Network as a whole, has a 76% unvaccinated rate of hospitalization. It gets even worse in the intensive care unit. At the Hershey Medical Center, they have 33 COVID patients in their ICU, and none of them are vaccinated. Reading has 15 ICU COVID patients. 14 out of 15 are unvaccinated. That's 87%. So the story goes on and on and on, but really this is an issue of the vaccination status of patients. And it's unfortunate because the staffing issue that we have and the issue at the hospital that we have is almost entirely avoidable if we had better cooperation with people obtaining a vaccine. I know this may not be something some of you even want to hear. Maybe some of you on the line are not vaccinated, and I guess that's the way it is. But that's the truth of the matter. Is it's a vaccination issue, and it's a shame, really, because this is all avoidable. We have put our healthcare system in dire straits. We are getting very close to the point where we are not going to be able to administer safe care, not only to the COVID patients, but also the patients that are in our facilities for other reasons, chronic diseases, health issues, and emergencies. And more importantly, we are literally breaking the backs of the very people that 2 years ago we referred to as heroes. These healthcare workers are literally being worn into the ground with a tsunami of unvaccinated COVID patients. So I implore everybody to encourage everybody you know to get vaccinated. I said this yesterday. There is not one good reason not to get vaccinated unless you are allergic to one of the components of the vaccine, which is infinitesimally small. There is not one good reason. There's a lot of misinformation out there. The vaccines work. I'll give you an example. At our facility, we have, network-wide, we had 1.6% of the people that were boosted in an ICU. 1.6% in the ICU if you were boosted. And I'd almost guarantee you that person probably had an underlying malignancy, was on chemotherapy, had an autoimmune disease, something like that. The vaccines will keep you out of the hospital. There are breakthrough infections with the vaccines. These people typically do not come to the hospital. And that is the important thing right now, because the healthcare system, not only in Hazleton, not only in Pennsylvania, but everywhere, is on the brink of disaster. And it is purely a vaccination issue, 100% a vaccination issue. Just do the math. I'm going to stop there, and I'll leave time if you have any questions for me at the end. You can certainly feel free to ask me some questions.
Thanks, Tony. My name is Dr. Jody Lenko. I'm taking charge of answering some questions and giving some information about our testing, about our COVID testing, both locally and also within our network. As everyone has seen over the last few days, there's been a marked and dramatic uptick in the number of tests and the demand for testing. We knew it would happen after the Christmas and the Christmas holiday and the New Year's holiday. I don't think any of us predicted how much of an increase we would see. So for example, our testing compared from early December compared to the week between Christmas and New Year's more than doubled, beyond the capacity that the lab can do in a daily basis. So I don't think any of us predicted that it would increase in demand quite that quickly. And it's certainly almost all Omicron at this point. We are in the region that we are in Pennsylvania is about over 90% Omicron in Pennsylvania, Maryland, and New Jersey. And it does just show how quickly this virus is spreading due to the variant. I wanted to give a few pearls of information. We're struggling at our testing sites. I think this is across the board. We are struggling to keep up with the demand. So we're trying to do everything we can to encourage people who don't need to be there not to go for a test. The way you want to go about this, if you're home and sick with symptoms that you think could be COVID, stay home, first of all. Don't rush out to the emergency room. You don't need to be there right away unless you really need us, unless things are, in an emergency where you are short of breath or there is another reason for you to be in the emergency room. But just because you think you might have COVID, please don't come to the emergency room, or please don't come to your doctor's office. We want to try to use the means that we have developed over the past 2 years. On our website on lvhn.org/COVID, you will find numerous ways to get in touch with a healthcare provider that do not involve you leaving your house. So that includes video visits that are on demand that you can ask if you need a test. That also includes a 24/7 nurse line for patients that might not have access to a computer. There are lots of different channels and ways to get health information to find out if you need to be tested before simply showing up at a testing clinic, whether it's ours or anywhere else. The second thing, I think this has come up more recently with the number of rapid home tests that we're seeing. If you have symptoms of COVID or of flu-like symptoms and you take a home test that turns out positive, believe it, it's true. They're very sensitive in that situation. You do not need to rush out to confirm it with a PCR test in a clinic. All that's doing is adding additional burden to the testing sites that are already overwhelmed and to the labs. And that goes for us as well as any other, local testing center. We ourselves in LVHN are not requiring our employees to get a PCR test to confirm that they have COVID. If they take an at-home test and test positive for COVID, that is proof enough, and that we are not requiring any additional testing beyond that. So I think that will help eliminate some of the need and some of the demand. We hope that over time, there's less and less demand because there's less and less disease in the community, but we think that's going to take weeks. So please bear with us and be patient, but use all the avenues you have available to try to minimize the burden on our testing sites and especially in our emergency rooms. The other thing I wanted to talk briefly about is some updates on the isolation and the quarantine policies. Basically, the long and the short of it is if you are still sick with COVID, if you tested positive and you are still having symptoms, the 5-day rule does not apply to you. This is simply for people that are asymptomatic or have their symptoms almost completely gone. And if you're not sure, reach out to your healthcare provider, reach out to your primary care doctor, your pediatrician, or use some of our other options that we have available to you. And when you do come out of that, quote, early quarantine, if you are a candidate for that, please wear a mask and please do not go around anybody that could be susceptible and is high risk. There is still a 30% chance that you could be infectious between days 5 to 10. So I think there's a lot of information going around and it is very confusing, but doing everything we can to stay safe. And the mask is incredibly important. So making sure everyone is wearing an appropriate mask, a surgical mask. If you have the opportunity to get a surgical mask, highly recommend that over a cloth mask. And even a KN95 is even better than a surgical mask. And finally, a lot of questions about the vaccine after you've had COVID. If you were one of those that decided not to get vaccinated or have not gotten vaccinated to this point, but are thinking about it, and you might have just had COVID, you can get your vaccine at any time. As soon as you are out of your quarantine isolation state, there is no reason to delay. I would strongly recommend getting vaccinated as soon as possible. Same thing for the booster shot. If you didn't get your booster and recently tested positive, you can get your booster shot as soon as possible. And I think just to echo Dr. Valente's point, overall, we need your help. I think that's the bottom line, is we're asking the community to do everything you can to help us. We've all gone into this because we want to help people and because we want to help our community. And right now we're all deathly scared that we're not going to be able to care for our community the way we know we can. So everybody, if you can, help us. And I think one of the big things that I would ask and everybody when they leave their house is to put a mask on. It's not mandatory in the state of Pennsylvania in public places right now, but it should be in your best interest and in everyone's best interest right now, the way we are, to mask anytime you're outside of your home. I do it with myself and my family every day. And I think those are all of my points that I have right now. Lisa, I don't know if there's any other talking points or if you wanted to open it up for questions.
Just wanted to give Dr. Evans a chance if he wanted to add to anything that the three of you had said. Dr. Evans?
Hi, yes. I don't have any prepared remarks, but just in listening to what was said by everybody, I think it's been very appropriate. I did have 2 points that I just wanted to take the opportunity to stress. Dr. Valente mentioned the breakthrough infections, and I think, you know, those of you in the media could help us hopefully clarify some popular misconceptions. I think with these breakthrough infections, I think there's a group of people or some people that think that it means that the vaccine is less effective. That is definitely not the case. It might be true that with Omicron we are seeing more breakthrough infections than we saw with other variants, but the vaccine is still very effective at keeping people out of the hospital and preventing death. And so it's still a very effective vaccine despite the breakthrough infections. And the other point was the idea that this is a less severe variant of the virus. I think there's a lot of people who believe that, and you know, it may be true, but I think we're right in the middle of this this surge, and so I don't think we know. But I think what we do know is that because we have a higher rate of vaccination and because we have an effective vaccine, but with breakthrough infections, we are seeing more infections and less people, the percentage of people getting infected who are getting hospitalized is smaller. So the key point is, like Dr. Valente said, there's still obviously enough people out there who are unvaccinated that when this very contagious variant spreads through the community, there's enough people who are still getting sick and sick enough to require hospitalization. So just can't stress enough how important vaccination is.